All right, give me 1 second here. Hey, Elizabeth, would it be okay if you pulled it up on your end?
Oh, of course.
Okay.
I'm happy to. Give me 1 moment.
It's going to take me probably a while to figure it out.
You're fine. No worries. Everybody see that okay? All right, great. Just let me know when you want the next slide.
Perfect. Yeah. Well, happy to be here, everybody. Happy Wednesday. Hope everyone's having a good lunch. My name is Angelo Gilzetti. I'm a clinical psychologist here in BMed up in Morgantown. And a big part of my role here is working with caregivers of patients with dementia or neurocognitive disorders. So my brief talk today will kind of go over a little bit about caregiving, some of the responsibilities that caregivers have, especially in the face of dementia, and a little bit about some of the stresses involved with caregiving, how it affects caregivers, and then most importantly, and probably most in terms of help for providers out in the community, we'll go over some strategies, some brief strategies to think about if you just have a few minutes with a caregiver in your office, of how you can support them in taking care of their loved one or friend with dementia. So we can go to the next slide. So caregiving, here's kind of a pretty intuitive definition for you. It's attending to someone else's health needs and well-being. So nothing fancy there. But if you think about it, think of your own relationships, important relationships. There's an element of caregiving in most close relationships, if I would argue probably all close relationships. But it's only going to be kind of a piece of that relationship, right? And it's going to kind of get activated and grow if your loved one or a close friend or family member gets ill. For example, maybe they have flu for a couple of days. Your caregiving responsibilities, your attending to that person's needs and well-being is going to grow. And maybe it takes up the majority of kind of your roles and responsibilities in that relationship for a few days. Hopefully they get better, and your relationship and the dynamics within your relationship kind of bounce back to how they have historically been. But what we'll see and what we'll talk about today is in dementia, particularly, the relationship with the caregiver changes drastically. So the diagnosis of dementia kind of has a profound effect on the dynamics within the caregiver, within the family system, that changes constantly as the disease progresses. We'll talk a little bit about that more going forward. So caregiving is attending to somebody else's needs, well-being. Caregiving in dementia has some really specific responsibilities that are listed here. And as you can see, they're pretty comprehensive responsibilities. And at the beginning, as the disease is first diagnosed, the caregiver that you see in your office or your clinic is not probably going to be engaging in all of these responsibilities. But eventually, depending on the circumstances, of course, but generally, sure, yes, thank you, Teresa. Yeah, I definitely will. Thank you. I'll definitely define those acronyms. What will happen is eventually the caregiver will probably have most, if not all, of these responsibilities as part of their caregiving responsibilities. And I'll go through these here briefly. So a caregiver of somebody with dementia is going to be providing assistance with ADLs and IADLs, which is activities of daily living and instrumental activities of daily living. And there's a range of those kind of activities. ADLs are commonly, eating, getting dressed, going to the bathroom, ambulation. Instrumental activities of daily living are going to be, housekeeping, managing medications, managing finances, working the telephone, etc. So a caregiver of somebody with dementia is going to be providing growing assistance to those kind of basic day-to-day activities that as adults we need to do to kind of manage our affairs in a kind of a safe and effective way. For those of you who work closely with patients with dementia, there's oftentimes, if not all the time, there's other medical conditions in the medical history, right? It's not just dementia, it's not just Alzheimer's disease or vascular dementia. There's going to be many other conditions as well too, and the caregiver is likely going to have to try their best to manage those conditions as well too, which requires coordination of care with many medical teams, not only hopefully a memory team, but primary care teams. Maybe they're working in cardiology, etc. So the caregiver is going to be very involved with multiple medical teams and clinics, especially as the disease progresses. Unique to dementia is the behavioral and psychological symptoms of the disease. So we have the cognitive symptoms generally, the forgetfulness, the executive dysfunction, the changes in social cognition. But up to 99% of patients are going to have these behavioral and psychological symptoms, which are commonly changes in mood, depression, anxiety, sleep weight disturbances. So maybe sleeping during the day and waking up at night, or sleeping in fits and starts throughout the night, wandering, trying to leave the home, aggression, hallucinations, delusions, impulsive behaviors, inappropriate behaviors. Those are all what we call behavioral and psychological symptoms. And caregivers are going to really be on the front lines to managing these symptoms because, as you would expect, they're going to be occurring at home and out in the community. And typically this, at least in kind of my professional experience, this is probably some of the most stressful parts of managing and caring for somebody with dementia. Seeing your loved one really kind of have changes in personality, become aggressive, hallucinate, have delusions, paranoia, try to leave the home at 3 a.m, sleeping during the day and up at night. As you can imagine, those are going to have profound impacts on the person taking care of them. Caregivers are also going to be in charge of coordinating support services for the person with dementia, which includes hiring care providers. So many of the caregivers I work with eventually try to get some extra help in the home through like paid caregivers or home health aides. And so in effect, in essence, that the caregiver kind of in some ways becomes kind of like an employer. So they're going to interview these people sometimes, or coordinate with the local home health agency, because someone's coming into their home or their family member's home. They're going to be more inclined to supervise in some ways, make sure that the person is showing up and providing good care to their loved one. So they're going to be in some ways kind of an employer as well to all these other responsibilities. Next, oftentimes there's families, big families, and lots of people involved in the person with dementia's life. Typically, in kind of my experience, there's kind of a main caregiver. Maybe it's the spouse or one of the adult children of the patient with dementia, but there's going to be other family members sometimes, kind of maybe on the periphery or closely involved in the care. So the primary caregiver or caregivers are likely going to coordinate care and aspects of the care with the other family members as well too. So that includes maybe updating the family members on recent medical events or changes in behavior, or coordinating some of this hiring and supervising of the care providers. Caregivers are also going to be providing emotional support to the person with dementia, especially as the disease progresses. They're going to be there day in and day out as this person with dementia navigates the changes in their brain. And then lastly, a big part of the responsibility is really just promoting the management of the patient's day. So structuring the day, kind of incorporating positive activities in the day. And then most importantly, I'll talk about this towards the end, promoting the safety of the person with dementia. So making sure that they're not wandering, or at least decreasing the chances that they are wandering, making sure they don't have access to dangerous objects or getting into trouble in the kitchen, or oftentimes not driving and not having access to a car. So a huge list of responsibilities that require a lot of time, a lot of emotional investment as the disease progresses. You could go to the next slide, please. There's caregivers in for many different medical conditions: Parkinson's disease, cancer, ALS. Caregivers in dementia are more likely to monitor the health of the person with dementia compared to other caregivers, assist with mobility tasks, self-care tasks, assist with their medical care, also assist with activities of daily living, which are kind of those basic things that one needs to do to kind of take care of oneself. So bathing, grooming, eating, getting dressed, etc. Next slide. So who are caregivers? So these are statistics within the United States from the most recent annual edition from the Alzheimer's Association about dementia, from their facts and figures. It's a really comprehensive publication that comes out every year. You can just Google Alzheimer's Association disease facts and figures, and it'll come up for you if you want to read more in depth. But nationally in our country, 2/3 of caregivers are female, about 1/3 are 65 plus. 50% of caregivers are providing care to either their parent or in-law. 10% provide care to their spouse. This statistic, not having any hard data, but just kind of anecdotally from my professional experience, doesn't match up with my experience. In my caregiver clinic, definitely have more than 10% of caregivers who are spouses. So just a brief anecdote to think about, but at least nationally, that's what the Alzheimer's Association has found. Other demographic characteristics: 2/3 nationally, caregivers are white, 10% Black, 8% Hispanic, 5% Asian, 40% have a college degree or higher. Average household income of caregivers, about 40%, 41% is less than $50,000 a year. I want you to hold that in your mind real quick, because we'll come back to that in just a second. And 1/4 of caregivers are what we consider or call our sandwich generation caregivers. And that's a caregiver who is not only caring for their parent with dementia, but also they have kids in the home as well too. Hence the sandwich. So nationally, there's more than 11 million Americans that are unpaid caregivers in dementia. Almost 60% of caregivers have been providing care for over 4 years. So think about that. That's just a long-term commitment, 4 or more years. So it's a huge commitment that grows with each passing year as the disease progresses. Last year, the Alzheimer's Association estimated that there were 16 billion hours of informal unpaid caregiving, with an estimated kind of economic value or output of over $250 billion. So huge amounts of informal unpaid caregiving that's being provided by these millions of caregivers around the country. Estimates for the lifetime cost of the care for the person with dementia is almost $400,000. 70% is being borne by the family caregivers through out-of-pocket expenses, and then this informal caregiving that happens. So if you think about that previous slide with the average household income, that's going to be a huge, huge financial strain, right? And we'll talk a little bit about the impact of that on caregiver emotional health. So it's very expensive. Most of the costs are borne by the family, and huge kind of economic cost on them. And that stat is actually likely underestimating the lifetime cost because it's not including the lost economic productivity of the caregiver. So missed work, having to cut back on work hours, going part-time, or just having to stop work is not included in that. All right, so lots of responsibilities in caregiving and dementia, lots of financial costs, costs to your time, there's costs to your emotional health, there's costs to the relationship you have with this person with dementia as they change. So there's a term, this term we call caregiver burden. And when I meet with a caregiver, this is kind of what I'm assessing for. And it's not on the slides, but there's a screener called the Zurich Burden Interview. It's 12 items for those of you who are interested in screening for caregiver burden. That's a kind of a common screener in the field to assess for caregiver burden, which is essentially, as the slide says, the physical difficulties experienced by caregivers as they care for somebody, the psychological and emotional toll, the social toll, and the financial difficulties. Next slide, please. So caregiving has some profound effects on the caregiver's physical health. So caregivers are going to rate their health more as likely to be poor or declining, or just harder to kind of do the things that they think kind of maintain their health. They tell us that they have less time for exercise and making healthy food for themselves. They're going to have increased cortisol levels and inflammatory markers. They're at increased risk for hypertension, metabolic syndrome. And there's actually, unfortunately, some research out there that shows that the caregivers have just a higher risk for all-cause mortality. So some pretty big consequences on caregiver physical health as they take on this caregiver role over the years. Next slide, please. Caregiving can also have profound changes on their mental health too. So about a third of caregivers develop depression. They're more likely to think about suicide. They have higher rates of anxiety, and they also tell us they have worse sleep as well too, which, you know, for sleep in particular makes sense. If their loved one is not sleeping and up all night and sleeping during the day, they're you know, obviously not going to be sleeping well themselves too. Next slide, please. Caregiver depression has an effect on the person with dementia as well too. So caregiver depression has actually been shown to influence the rate of cognitive decline in the person with dementia. The person with dementia is going to be rated as kind of more having more depressive symptoms, and it gives them an increased risk, the person with dementia, for premature nursing home placement. So it goes both ways. Next slide, please. So with that being said, you know, what can we offer caregivers? Well, there's a lot of things we can offer them to help them manage the caregiver role. And this is not an exhaustive list, but some really important things to think about if you have a caregiver in your clinic with maybe your patient with dementia, or just maybe a caregiver by themselves who you find out later is caring for a loved one with dementia. So case management and psychoeducation is a really nice intervention for caregivers. And what does that mean? Really, it means connecting them or educating them on local resources in the community to support them in their caregiving role. And I can go over some standard recommendations you can share with people in just a second. It means providing education about the disease, the process, education about the behavioral and psychological symptoms of dementia, pointing them towards reading resources online, to books, anything to increase their knowledge, is going to be helpful in the short and long term as they are in this caregiver role. Psychotherapy, counseling also is going to be really important to think about as a tool for the caregiver, especially if they're depressed and anxious, not sleeping well, or just have high amounts of stress, which they likely do. Good psychotherapy can give them some tools to manage the depression, manage the anxiety, improve their sleep, manage their stress, and really just develop some problem-solving skills to help them manage the caregiving role. Respite care, that's kind of a fancy way of saying a break. So this is often something I suggest throughout my work with caregivers is essentially how can we problem solve some ways for you to get a break, a respite, even if it's for an hour, 30 minutes, 15 minutes. How can we problem solve that today? So you can get some breathing space to kind of turn your mind off, to do something positive for yourself, to connect with a friend, to take a walk, to do things you need to do. But how can we get you a break? Either a short one. In some areas, there's adult daycare center. So how do we get your loved one with dementia maybe into an adult daycare center? When I used to work at the VA down in Clarksburg, we could get our veterans with dementia into a respite care, essentially a brief nursing home placement. If the caregiver had to get surgery and was going to be hospitalized for a couple of days, and there was no one else to watch or to monitor the person with dementia, we could get them in either at the VA or in a private nursing home for a week or two. And so that's a form of respite care for the caregiver as well too. And then support groups are also going to be really important. The Alzheimer's Association runs support groups throughout the state of West Virginia. So encouraging them to contact the Alzheimer's Association, alz.org. I'll have that information later. But they have a 1-800 number that's 24/7, 365 days of the year answered. And so you can encourage them to just call that number. It's on their website, and ask to be connected with the West Virginia chapter and the support groups. They can get connected. We have one that's run here in Morgantown at the RNI. That's the first Wednesday of every month from 11 to 12. And so that's also a good resource, right? Because they're going to be around other caregivers, problem solving together, supporting each other, sharing resources, sharing information, and just being there for each other. So again, intervening with caregivers, if you just have a few minutes with them, again, they're attending, a clinic visit with your patient with dementia or by themselves, resources are very important. I often talk about building a team with the caregiver. So oftentimes, as I mentioned, caregivers feel, oftentimes they're by themselves doing this. So they're kind of alone on the field. So I asked them, well, how can we start building in other team members for you, right? So maybe you're the pitcher, or maybe you're the quarterback, but it's football season, so we can use football here. How do we get you a running back? How do we get you a wide receiver? How do we get you a front line? How do we get you people on the sidelines, right? How do we get you some people in the stands, right? So that you can play effectively. And so these resources hopefully can act as those team members. So the local senior center is probably one of the most, that's a good question, Jackie, and let me come back to that in just a second. So the local senior center is super important. Every county has a senior center here in West Virginia. In Maryland and Pennsylvania, they're called aging centers, local aging centers, I believe, or area agency on aging. I always get that confused. But directing them to that local center, the local senior center is going to be the expert on local county resources, home health agencies, benefits, et cetera, through the state that they may be eligible for. The local chapter of the Alzheimer's Association, every state has one. So encouraging them to contact that organization is going to be helpful. Okay, thanks, Amanda. Thank you. The Bureau of Senior Services through the state of West Virginia is also going to be a resource. They have if you go on that website, right in the middle, there's a section called Help at Home. Have them click on that, and there's some good information about state level services that can be helpful. The West Virginia Aging and Disability Resource also can be helpful. And then if you ever have a caregiver whose loved one, the patient has dementia and they're a veteran, please consider making sure they're connected with the VA. I say this as someone who worked at the VA for 10 years. The VA has lots of great resources, not only for veterans with dementia, but also they have really nice caregiver support programs nationally at every VA that can offer not only resources and education to the person caring for the veteran with dementia, but also some treatments for the caregiver that reduce caregiver burden. Next slide, please. Again, if you have just a few minutes with a caregiver, I can't stress enough the importance of just some brief educational interventions about stressing the importance with the caregiver about creating structure and routine for the patient with dementia at home, having that structure and routine kind of in the sweet spot between not overstimulation, so lots of changes, lots of people coming and going out of the home, but also not understimulation or boredom, right? Of just like sitting in front of the TV all day, watching TV. How do you create, and I ask caregivers, how do we create a day that's kind of predictable with routine, that's not understimulating, boring, overstimulating, that's filled with positive activities that really match the person with dementia's interests, and then most importantly, their abilities. Communication strategies are also going to be really important. It's very hard, and understandably so. As a caregiver, you think about, maybe this is a parent, you've known this person your whole life, or this is maybe your partner, you've been married for many decades. You've had a certain way of relating and talking to them for many decades, if not your whole life. But dementia requires such a profound shift in communicating with your loved one. And that requires and entails some of these strategies, and there's many more that I go over with caregivers. But just the importance of just positive eye contact, good tone of voice, calm voice, limiting choices, one or two choices, et cetera. Those brief communication strategies or reminders can go a long way in terms of kind of having more calm waters at home with the person with dementia. Softening expectations is another thing that can go a long way with caregivers. Again, our caregivers have related to these our patients with dementia for so long, and dementia requires kind of a shift in what you expect of this person with dementia as they decline, and that's incredibly challenging. And just saying that doesn't do it enough service to kind of capture how hard it is to change your expectations of your parent or partner, not being able to do something again, or having this, symptom of behavioral and psychological symptom of irritability or depression or sleep changes. So helping the caregiver slowly shift their expectations of maybe, your loved one with dementia is not able to do that anymore, and matching their expectations with the patient abilities can also go a long way in terms of helping with caregiver stress. Patient safety at home is also going to be really important. So again, if you have a few moments, helping the caregiver go over, important safety topics like firearm safety, making sure the person with dementia does not have access to firearms. The firearms are removed from the home or at least safely stored away. Checking in about kitchen safety. Are they leaving the stove on, misusing the microwave? Do they have access to sharp objects? So disconnecting appliances or putting kind of safety locks on the stove knobs, etc. Access to vehicles, driving, removing keys, and some other kind of safety precautions to make sure the person with dementia is not driving. Wandering prevention strategies, of course, are key. So safety is also a good brief intervention you can do with the caregiver to help them start to think about, how do you make the home safe for your loved one with dementia. The Alzheimer's Association also has some good literature on that too, have a couple nice handouts around home safety that you could also consider sharing with them, or at least pointing them to on the internet. Next slide, please. And then lastly, again, you're meeting with a caregiver, they're accompanying you, your patient to the appointment. The focus is on the patient. Again, caregivers often feel alone. They may be managing all these responsibilities, day to day, without support or with very limited support. So I'd encourage you to think about just carving out just a brief moment to check in with them and say, hey, how are you doing? I know how stressful this is and how much you got on your shoulders. How can I help you? And encouraging them to make sure that they're taking moments for self-care, building their team, accessing their social supports, bringing in other family members as possible. And then if you sense, or if they're telling you something that makes you concerned, that they're really struggling, or maybe suffering from depression or anxiety, trying to link them up with professional supports in the community can go a long way. Because ultimately, if we can get our caregivers good supports, that's going to help our care with the patients, right? With our patients. And if our patients are doing well, our caregivers are likely going to do better or well as well too. I think that's pretty much the end. So a couple takeaways. Caregiving is a profoundly stressful experience. If we had more time, and we could also talk about, there's also some positive aspects that can come out of caregiving. There's a whole literature based on resilience in caregiving and the positive aspects of caregiving and the growth that can come out of caregiving. So I hope you don't kind of take away from our brief talk today that it's all negative effects. There are many negative effects that most people experience, but there's also some not negative things that can come out of it as well too, in ways for resilience to build through the caregiving experience. But most importantly, we have some really effective interventions that can improve the lives of caregivers. And then by improving the caregivers' lives, we also improve our patients' lives, our patients with dementia. Because when we help caregivers, we help the patients and vice versa. So thank you. I see there's a couple questions, and let me pull them up real quick. So Jackie, you have a good question about barriers with respite. So when in 2020, when COVID first appeared and things were being shut down, and there were outbreaks, especially in nursing home centers. Yes, huge barrier just from when I was working with caregivers back then of access to care, and then also understandably fear, of placing your loved one somewhere where they could get COVID. I haven't heard, and this is just kind of anecdotally, in my own experience, I haven't heard much barriers to respite care now, but I could be wrong. But I think just, compared to what I was hearing 2 years ago, I'm not hearing that as much now. It's probably facility dependent and where you are geographically and your resources in the community. But hopefully those barriers are less than they were 2 years ago. There's one other question. Yeah, there are support groups. So the Alzheimer's Association has caregiver support groups throughout the state, both in person and virtually. So if you're sensing that your caregiver that you're meeting with needs an extra group support, have them call that National Alzheimer's Association hotline. It's on their webpage. They answer it 24/7, and encourage them just to be connected to the West Virginia chapter and to a local support group. So kind of personally in my professional work here at the RNI, I work some of my time with caregivers, and that's part of my work with folks is how do how do we learn skills and strategies to care for our loved ones with dementia. And some of that includes, matching expectations with the reality of what, what's on the ground, so to say. Yeah, and you're totally right. It's very difficult. Softening expectations, very difficult, and very complex too. There's a lot of history before the dementia develops. There's maybe a long partnership or marriage before, right? Or if it's your parent, there's a childhood, early adulthood, that people bring to the caregiving role and that affect the relationship. Yes, totally. And there's lots of grief and emotional support involved in caregiver support work, because it's a long disease process. And as it's been said before, it's a long goodbye. Seeing your loved one change slowly each day and sometimes very quickly. And so there is a lot of grief involved during the illness, and then of course after the illness as well too. So an important part of good caregiver psychotherapy is grief, acknowledging that and addressing that grief. So,
oh,
all right.
Thank you so much. That was so excellent. And just, I do feel like sometimes it's just overlooked or we forget about it, or unless you've gone through it or you have patients that are going through it, it's something we don't think about, especially when you're given the numbers and the statistics. That was pretty incredible. Christine, I saw you on mute. Did you have a question or anything?
No, I've
Okay. Oh, no, no worries. Does anybody have any questions or comments? And you will be getting those slides. Really appreciate it.
My pleasure. Thanks for having me. Hope this was helpful, and hope you all have a good rest of the day. Thank you.
Absolutely. Thank you so much. I know you got to run. I only have one announcement for the rest of you. October 5th, Lauren Swagger is going to be discussing motivational interviewing, which I think all of us could love that. It's like one of the worst things. I hate going through this. I'm glad I'm not doing that right now. But yes, I'm excited for that. And we really thank you and thank everyone's time. Just have a great week.